Hello again, everyone. Excited to pick up on that conversation and dive a bit more into the economic opportunities associated with health. I mean, this session is about the 12.5 trillion economic opportunity, which is no small share. But starting this session, as we have with a few others, we're sitting here in an environment where we've come out of COVID largely. Communicable diseases around the world continue to rise, affect populations, but also non-communicable diseases are on the rise, affecting not only the well-being of people around the world, but also productive capacity. And needing to think about health as not so much of an expense, but rather an investment. And I'm curious, as you're thinking about this issue and all of the work and research that you've done, and also the dynamic that we're in, for any health ministers who are either in the room or watching this session, why should they be thinking about health as a geoeconomic strategy rather than a budget line?
Yeah, absolutely. So I think first acknowledging the moment that we're in with all of the fiscal pressures, all of the crises that cause kind of attention to be drawn to different aspects. I think one important thing to really conceptualize health around is if you think about the disease burden of a country, whether that's communicable disease or non-communicable, you can think of that like an invisible debt on the balance sheet of that country. So it has interest payments in terms of not only higher healthcare costs, but also in terms of lower labor force participation and lower productivity. And if you think about prevention as a way to actually pay down some of that principal, that helps to reframe the conversation around health from, how much is our health spending, managing it like an expense, to what are we actually getting for that health investment? And not only health as a social benefit, but also an economic benefit. So one piece of research that we recently led at the McKinsey Health Institute looked at what would be the impact of scaling access to known cost-effective health interventions across all diseases, across all countries. And what we found was by scaling the things that we already know work, you could actually add nearly a decade to healthy life expectancy globally on average, as well as you mentioned, adding $12.5 trillion to the global economy annually by 2050. And so what this really points out is that the disease burden that is being experienced and that with kind of shifting risk factors and things like that is rising, that has a real impact on the economy, even if it isn't directly measured that way. And if folks want to read this research in more detail, you can find it at mckinsey.com/health of nations.
Thank you for that. And the statistics are clear, but yet those investments in prevention and known interventions aren't necessarily happening. And there's a little bit of a paradox there. And I think we also need to acknowledge the fact that, over 62 countries around the world and a significant share of the global population, those countries are paying more on interest on their debt than they are on health and on education. And you touched on this a bit in your beginning remarks, but with that fiscal constraint, how can those within ministries of finance, those within ministries of health start to think about and reconceptualize these investments differently and break down those silos that often exist to make sure that the scarce resources that countries do have are being utilized efficiently, and they're being targeted upstream to low-cost interventions that are in fact focused on prevention?
Yeah, absolutely. So I think there are a few barriers to why this hasn't happened yet, and that are important to understand and actually how to make it happen. So one of those is this idea of prevention as being discretionary. So when you think about kind of the money that you're paying for treatment, that is reacting to an active burden that is in the population now. But when you think about prevention, when fiscal times are tight, that is often the first thing to go, or is the easiest thing to defer. The second is really around this multi-sectoral problem. So health is not only a health ministry problem. Both like the Ministry of Education or Agriculture or other ministries not only affect health themselves, but are also affected by the health of the population. And so one example of how a country has tried to help address this is in Finland, where they actually have a cross-ministerial council that is not only the Minister of Health, but includes those other ministries in order to do that cross-coordination and that bringing those health outcomes to the cabinet level in order to really align those incentives, figure out how they're going to use the limited fiscal space that they have to invest in the right things.
I think that's such an interesting and important example. We've had so many conversations, and we've hosted a number of roundtables focused on health and health financing, and invariably it comes up that all of the activity and budgets are so siloed. We need to break down the silos, but how do we do it? And I think illustrative that you mentioned Finland, and it's important to learn from these examples, maybe imperfect, but they're being done, and I think they can be learned from to understand how can there be greater coordination and then prioritization of scarce resources. I'd like to dig into the details a little bit more about why we haven't focused on prevention to the extent that is necessary now. Often it's a matter of budget cycles, incentives, and so I'm curious and wondering if you can talk a little bit more about those incentives. How do we change the incentive structure so those budget allocations and actions are different and shift toward the upstream interventions and prevention?
Yeah, so I think one of the big challenges that prevention has is often the full returns that you get to prevention occur over a longer period of time. That said, it's not like it's a long period of time till you get any return. That's to get to the full return. So for example, there are studies that show tobacco cessation has an impact on readmissions within weeks of starting the intervention. And the WHO has their best buys for non-communicable disease interventions that are effective and are possible to deliver with less than $1 per person per year. So, and with those, they actually found the returns and the benefits were within the first 5 years. And so I think some of this viewing prevention as only a long-term thing and not recognizing those short-term impacts, I think is something that's important to consider. I think the second piece is really considering the way that you structure how you invest in these prevention interventions. So one example of kind of matching the investment to the timeline is something that Thailand has done around their health prevention fund, which is funded by health taxes, so taxes on things like tobacco and alcohol, and is a ring-fenced pot of money that is then used to reinvest in prevention. And because it is protected from kind of the annual budget cycle or kind of political changes within the country, that has helped invest in things like vaccinations or other things that have these longer returns and be able to actually prioritize those things.
Would you say that's a novel approach? How often or how common is that around the world in terms of those kinds of taxes being then allocated and somewhat earmarked for more preventative measures?
Yeah, so it's becoming more and more popular. I think at the UN General Assembly high-level meeting on non-communicable diseases last year, there was a lot of conversation about these best buys, especially those health taxes, as ways to not only affect the incentives that individuals have around the risk factors of tobacco and other things like that, but also providing a source of revenue that can then either be used for prevention or used generally, because it still has that health effect. But I think the other piece I wanted to talk about incentives is it's not only the incentives for the individual or for the investor. There's an example of, in the UK, they had a sugar-sweetened beverage tax that was going to be introduced, and actually most of the impact of that introduction was in producers reformulating their products to reduce the amount of sugar in them. And so that had that positive health effect, kind of not only from individual behavior, but also firm behavior.
Excellent. And then cascading effects throughout. Interesting. And again, thank you for pinpointing some concrete examples. They're really helpful to latch on to and think how they can be potentially applied or adapted elsewhere. And in the couple minutes we have left, I know you've been working on this research and related research now for years, and you have this powerful data, and you can make the case for this reallocation of investment. What is an action agenda coming out of your research, and what concrete steps can be taken by those who are in more decision-making authorities to utilize and leverage this data for their decision-making?
Yeah, so I think one of the actions that I would love to see is really taking the same rigor to the investments in health and the investments in prevention as we do to other types of infrastructure or other things that we do to kind of spur economic growth. And that isn't to say that there are health investments that we shouldn't do because they are the right thing to do. We should absolutely do those things. But when you take that sort of rigor, you can think about not only the economic return, but also, are you getting the health return to your health investment? Are the things that you're trying to do actually resulting in a healthy population that then has these downstream economic effects? So I think that's one lens on it. And then I think for some countries, it is a matter of needing to spend more on the right things, and in others, it's a matter of spending better and getting more of that health return on things.
And thinking about the metrics for success and return a little bit more holistically, because there are manifold and cascading benefits from that, right?
Yes.
And very important that you have the data to be able to inform those decisions and those investments going forward. So I do encourage you all to check out the analysis and the report after this. And thank you for sharing some of the insights with us today.
Yeah, happy to. Thank you.
Great. Thank you.